What's up, guys? Josh here. I'm doing this recording for my Alzheimer's project. So, here goes. Alzheimer's. What is it? What does it do? Who does it affect? Is there a cure? Before you can understand all that, first you need to know what dementia is. Dementia basically means diminished mental function severe enough to affect daily living. Dementia, however, isn't a disease. It's just an overall term that describes a wide range of mentally diminishing symptoms such as memory loss, communication and language abilities, ability to focus and pay attention, reasoning and judgment-making abilities, and visual perception. Now, in order to be diagnosed with a dementia-related illness, you must have severe impairment of at least two of those things that I just mentioned. Now, dementia is associated with many illnesses, such as Creutzfeldt-Jakob disease. Basically, it's just human mad cow disease. Parkinson's disease, Huntington's disease, but the most common dementia-related disease of them all is Alzheimer's, which accounts for about 60 to 80% of dementia cases on a whole. It is important to note, though, that not all dementia illnesses are permanent. The person could have a thyroid problem or a vitamin deficiency, and that's causing their dementia. So in these cases, if you fix the thyroid problem or the vitamin problem, the dementia can be reversed. So, yeah, it is important to note that it's not all permanent. So, what is Alzheimer's? Alzheimer's is a form of dementia that causes the person to lose memory and other intellectual abilities. Pretty straightforward. What does Alzheimer's do? Well, as we age, it's normal for our bodies to slow down, including our brains. We'll notice some slow thinking and problems remembering stuff, but that doesn't necessarily mean we have Alzheimer's. It just means we're getting old, and it happens. But Alzheimer's patients, they suffer from extreme memory loss, confusion, and other serious mental loss. We currently don't know what causes Alzheimer's, but what we do know is this. The brain has roughly about 1 billion nerve cells, and they all form together to make communication networks. Now, these formations, they all have unique jobs, such as learning, thinking, sight, smell, remembering stuff, hearing, touch. Basically, it all functions up there. Now, our brain cells, they work like tiny little factories, and while doing so, they also store and process information. Now, our brains are very powerful machines, and to keep them running, they need a metric buttload of fuel and oxygen. Now, many scientists believe that Alzheimer's prevents brain cells from functioning properly, thus causing them to eventually die and causing irreversible brain damage. So as one little spot starts to slow down, it eventually slows down even more and more, and it causes it to die, and it kind of starts to spread out. So that's kind of what they're thinking Alzheimer's, how it is. It worsens over time, and it has 3 stages. The first stage is early to mid. It usually lasts for about 2 to 4 years, and this is where you're going to find your frequent memory loss, particularly of recent conversations and events. So like the short-term memory starts to go. They place things in odd places, such as like accidentally placing the keys in the fridge or the wallet in the dishwasher, or you just find random things, kind of stored in weird, odd places. They start forgetting the names of like family and friends, especially like newer great-grandchildren or people in the nursing homes or wherever they're living, like those kind of people. They can't really follow directions too well because they can't remember like to do this, do that. They just forget. They like to sleep a lot, and they get lost in like familiar places because stage 2, which is moderate to mild, that lasts for about 2 to 10 years, and they can no longer remember family or friends. So this is where this long term starts to come in. Like, first they were kind of forgetting who they were. Sometimes they remember in the early to mid, but now here in the moderate, gone. They don't remember you. They forget, like, they start to forget their personal history, like where they came from, where they grew up, where they went to school, stuff like that. Like like I said, the long term stuff. That's gone. They'll start to ramble about weird things. They'll have unusual reasoning. Like they're not logical anymore. Excuse me. They may start to have delusions about stuff. Their mobility and their coordination starts to go, so now they start to like tremor a lot. They'll start to fall more, so you guys start to kind of watch out for them. Stage 3, which is severe to late, that lasts for about 1 to 3 years. Typically, patients, once they're hit severe to late, their brain just starts to go and kind of just eventually just mushes out. But in these stages, you got to watch out for total confusion of past and present. They have no idea anything anymore. Like what was yesterday, what's today, what year it is, what day it is. They have no idea of anything anymore. They can no longer remember, communicate, or process information. So if you tell them something, it literally just goes in one ear, right out the other. They have no, it's like talking to a baby. They probably actually baby would soak in more. They start to hallucinate. They probably won't be able to talk anymore or get around. They won't be able to move like whatsoever because their brain those areas have gone. They're dead. These people, they need 24/7, round-the-clock care. They need someone with them at all times. They're the ones who need it. Who does Alzheimer's affect? Well, generally, we see Alzheimer's in people who are 65 and older. But it's not a normal part of aging. Getting Alzheimer's is not normal. Like, we're not supposed to get old and just start to, like, no. Alzheimer's is something that it's a disease, and it sucks. But it doesn't necessarily only affect old people, because there is early onset Alzheimer's, which you can get in your early 40s. So that's when you start at stage 1. You start really forgetting stuff, and it may take a lot longer for you to get into like stage 2, but it's there. And at that point, that's when you want to start doing your best to do mental stuff, like mental stimulation and whatnot. Alzheimer's, it doesn't just affect, though, the person who has it. It also really affects the family and friends. When I talked to my mom about my great-great-grandma, we called her Nanny. She had Alzheimer's the last few years of her life. And my mom said that was honestly one of the hardest things she's ever had to go through in life. When I talked to her, she said this to me. She's like, well, walking into my great-grandma's room at the nursing home with my 3-year-old son, it's me, in my arms, and having someone who I love and admired so much ask me who I was, it broke me. Like, I can't imagine what my mom went through then, because she grew up with my nanny. My nanny was amazing, and I don't know, just like that feeling of her to like look at her and just not know who my mom was. I genuinely, I couldn't imagine. Like, it's depressing for the people who have the early onset stuff because they know what's coming, and it's really really brings them down and really sucks them down. And it, for the loved ones, I mean, they feel grief, they feel sadness and everything, because they're watching their loved one just slowly, mentally just crumble, and it's horrible. Um, Sadly, there's no cure. I mean, we don't know what causes it 100% to begin with. I mean, there's speculation with age and genes and environmental stuff, but we don't know. And so, I mean, without even knowing with 100% what causes it, we can't even really cure it. I mean, we have drug and non-drug options out there to help with cognitive and behavioral symptoms, but that's only going to help for so long. Once you get into like late stages of once you get into like middle to mild on Alzheimer's, there's not really much we can do anymore. And that's why a big topic right now with Alzheimer's is euthanasia. And is it right? According to CNN, historically, children and people with Alzheimer's are two segments of the community that have been viewed as not being competent to make decisions that would be in their best interest. But in Belgium, as of 2013, as of 2014, they were trying to decide whether or not, and it's still going up in arms right now, whether or not to extend the right of euthanasia to Alzheimer's patients. But in New Zealand, in 2013, they paved a way with a bill that would allow New Zealanders to include assisted suicide in their living will. So, like, if they think that they're going to get Alzheimer's, or they're worried about dementia or any kind of crippling disease like that, they can have it as like a good planning tool. Like, if I get dementia, at least my family knows what I want. They know that I'm gonna, I don't want to live like that. I don't want to suffer, and just put me out of my misery. And personally, I hope that when I get older, wherever I live at that time, that is an option. Because I personally would never want to have dementia or Alzheimer's or anything that is just going to slowly strip me of who I am. I mean, I couldn't imagine going through that myself, and let alone my family having to take care of me and my family having to watch me suffer and just deteriorate from the inside out. It's horrible. But yeah, so personally, I think euthanasia is a great thing, especially with Alzheimer's people, and someone who has Alzheimer's in their family or is just genuinely worried about it, to be able to sit there and say, I don't want to go through this. I don't want to have this in my life. Like, if I start to go out, just put me out. Well, that concludes my presentation on Alzheimer's. I kind of went through and gave you a brief little description of everything, and a little personal history and personal feelings towards it too. And yeah, so I hope you guys enjoyed my presentation, and yeah, have a good one.